You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing and Hayes. Find them in the Next Tech directory.
Dad, you won't believe what I just saw.
What are you talking about?
The Giants!
Giants? I'll show you a giant.
Yes!
15 All-Star Giants!
Not you, Dad. The giant African dinosaurs at the Sternberg Museum of Natural History.
Oh, those giants. Let's go now.
Yes!
Come out to the Sternberg Museum of Natural History for a once-in-a-lifetime experience exploring the featuring exhibit, Giant African Dinosaurs.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of the West Central Kansas Smart Start program. And with me today is Margo Straub. Good morning, Margo. How are you today?
Good, good.
Now, first of all, Margo, tell us, where do you work and what do you do there?
I work at Hayes Medical Center. I actually work in 2 different clinics, but I do some work in the pediatric clinic as a physician assistant. So I see patients there and deal with different diagnoses.
Okay. Now, we're going to talk about a subject today that's very important to me and to my family, and that's diabetes. And I'll say right off the bat, my husband is diabetic. My father-in-law, my mother-in-law, my mother was diabetic. My cousins are diabetic. So this is something that's very important to me, and I think it's really important that we let people know about that. So first of all, what is diabetes?
Well, diabetes is when your body is unable to handle the sugars that you take in, which are glucose molecules. As there's different types of diabetes, and some are that you are more resistant to insulins, and some is that your body is not making the insulin.
Now, this program is about children. Is there one type of diabetes that children are more prone to?
Even though childhood obesity has become more of an epidemic and we've seen a rise in type 2 diabetes, type 1 diabetes is still by far 2/3 more diabetics are diagnosed with type 1 than type 2 in children.
Now, you mentioned type 1 and type 2. What is the difference in those two?
Well, in type 1 diabetes is a failure in the pancreas. The pancreas is an endocrine organ that makes insulins in our body naturally, and there are different reasons that they think cause that destruction of those cells in the pancreas that reduce the insulin. And if you can't make the insulin, then you can't use the glucose, and glucose, when we break it down, is for energy. And type 2 diabetics, sometimes it's the obesity, when we're bringing more sugars and we have more in our system, that we just can't keep up with the insulin in some people, and some people, they become insulin resistant, so that the cell is not able, even with the insulin, to take up those sugar molecules into the cell to be processed. It's kind of like a lock and key, where the key is not fitting in the lock.
Now, thinking about type 1 diabetes, what are the signs that a child might be experiencing type 1 diabetes?
Well, some common symptoms are what are called polyuria and polydipsia, which a lot of people know as a urinary frequency, that they're going to the bathroom all the time. In children that maybe aren't potty trained, you could notice that the diapers are abnormally wet and that they're always just really soaked through or maybe wetting out of the diaper. In children that are toilet trained, sometimes presents as bedwetting or wetting at night, or incontinence during the day even, because they're just making so much urine they can't keep up with it. Glucose is a big molecule, and in order for it to get out of our bloodstream, our kidneys filter it out, but to get it out of the system, we need to push a lot of fluids in, and of course that would make us need to void more often. Polydipsia is where you're thirsty all the time because you're having all these losses of fluids that you're really thirsty and you want to drink all the time. Also, those high sugars make you want to drink more because the osmolality in your bloodstream is more. Another common with type 1 diabetes is actually weight loss, that you have all of this you're getting all of these fluids out. So of course there's loss there, and you're also not using your glucose very well. So your body's breaking down other muscles and fats to help compensate for that.
Now, type 2 diabetes, will the symptoms be the same for parents to be on the lookout for?
Typically, they're a little bit different. Of course, the high sugar content can still always cause you to drink more and eat more. Typically, with type 2 diabetes, there's more obesity related, because like I said before, with the obesity, you have more sugars in your system from taking in those and not processing them well.
Now, quickly, you can do the subject quickly, how would you treat diabetes in a child?
Well, there's different treatments for the two different types. Type 1 diabetics, like we talked about, are insulin deficient, so you have to actually replace them with insulin. We've made a lot of advances in science. It used to be that we got it from animals, and it was very unsteady, knowing whether it had broke down in some or not. The vials, typically you have to keep cold, and you have to use syringes and needles, otherwise they will break down. Something newer, the pens, the insulin pens, which are really nice. Once you open them, you don't have to keep them cold, and you can keep them with you, which are really nice to dial up and give yourself injections. The other thing is they now have an insulin pump, which just has
have one at our house.
one stick a day. So it's giving you continuous quick-acting insulin, and then you give yourself boluses with your meals to try and compensate and make it as normal as you can make it to what a normal system would be. In type 2 diabetes, typically you start with diet and exercise, trying to reduce that weight, because that can help reduce the amount of sugars in your system. When that becomes a failure, then we have to go to oral medications, and there's several different types of oral medications that work differently. Some, keeping your liver from producing some sugars. Some can make your insulin more sensitive to the cells. Some help your pancreas work better and make them produce more insulin. So there's a different variety, and it's kind of the art of medicine and figuring out what's best for each patient.
Now, these are all treatments. There's no cure for diabetes. Yeah. So what does a high blood sugar do to your body?
Well, you definitely want to keep your blood sugars down. They have very toxic effects on your organs. You can damage your eyesight if your sugars are constantly high. Your kidneys, of course, because we talked about the filtering all those big molecules and pushing, they have to work a lot harder if your sugars are constantly high. Those big molecules are also bad for heart disease because they can help clog those arteries a little bit faster. So there's kind of a plethora of symptoms, and if you're higher sugars, you don't heal as well or as fast, and that leads to a lot of amputations and things like that. So.
Now, if someone wants more information about diabetes, who can they contact?
You can contact me at the Pediatric Center, or any of our doctors are willing to talk to you, or if you're concerned, we can do some testing. The pediatric clinic number is 623-2360. We would test if we feel that you need to be seen by endocrine. The Children's Mercy group out of Kansas City, they actually do quarterly visits down here, and usually that first one has to be in Kansas City. But.
Well, thank you for giving us some very good information. You've been watching You and Your Young Child, the program devoted to early childhood. Parents, remember, you are your child's first and best teacher. Thank you.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry and by the Sternberg Museum of Natural History.